Well, we now know there is a possible case of hantavirus here in Illinois.
The Illinois Department of Public Health strongly denies any connection, though, to the recent cruise ship outbreak of the virus. The World Health Organization now tracking 11 reported cases, 9 of which confirmed through testing. 18 passengers are at specialized quarantine and biocontaminant facilities in Omaha, Nebraska and Atlanta. One person in Nebraska tested positive but is not experiencing symptoms. Health experts say, given the long incubation period, some 42 days, they expect to see more cases, but they stress there's little risk to the general public. Now, we know you have questions about it, just like we do. So
we want to bring in Dr. Stephanie Black from the Chicago Department of Public Health. Dr. Black, great to have you with us.
Thanks for having me.
So we know we want to have information here. We don't want people to be, scared or have fear. So let's just talk about, with the Chicago Department of Public Health, there are no cases in Chicago, but what are you guys keeping your eyes on? What is the city doing to prepare? Just kind of fill us in on that, please.
Yeah, sure. So I do want to reiterate, as you said, that this individual who has a preliminary test positive has not been confirmed to have hantavirus. But the strain we're concerned about is completely different. It's called Nombre virus. It's different than the virus that is associated with the cruise ship. And so what we are doing to stay on top of this is staying connected with CDC and other state and local health departments to get cutting-edge information about what's going on with these passengers, and putting the word out to folks through social media. We have some frequently asked questions that are going to be available on our website today, and also informing clinicians through alerts about what's going on.
Dr. Black.
But do want to reiterate that the risk is extremely low to Chicagoans.
You mentioned what the state and other, municipality health departments might be doing in terms of the cases from the cruise ship. Does that include contact tracing to see if anyone here in Illinois might have been exposed or near somebody who had also been on that cruise ship?
Yeah, we already know that no one from Illinois was on that cruise ship. So, and each one of those passengers is being followed. Folks now are either returned home before the outbreak was identified and are being followed by their local jurisdiction, or they're in Nebraska, having been flown home after the outbreak was identified, and they are being closely monitored there.
And we know the Illinois Department of Public Health, as we're talking about here, says that the person in Winnebago County did not travel internationally. And so I do want to ask you, for those watching and they're curious about the strain, because like you said, it's different than the one with the cruise. Can you just clarify how it can be transferred, the one that we're talking about here in Illinois?
Yeah, so it is transmitted by exposure to aerosolized rodent droppings. And it's really actually the white-footed deer mouse that is the vector. So if you're in areas like unused buildings or cabins or sheds or barns or cleaning out areas, that's where you can sort of sweep and kick up dust and those droppings, and they get aerosolized and inhaled. So that's how that particular virus that we have in the United States is spread. It's very different than the Andes strain associated with the ship.
Okay, so take precautions if indeed you happen to be cleaning up a building with rodent droppings. Dr. Stephanie Black,
right.
Thank you.
You want to wet them down and wear a mask. Wet down the area.
Okay,
Yep.
Really important, because I don't think people up until this point, many people would have even thought of that. Dr. Stephanie Black, thank you so much for joining us live this morning. We really do appreciate it.
Thanks for having me.